I think the questions you need to ask yourself is really, what is this doing to me on a daily basis from a pain standpoint? Can I take a Tylenol? Can I take a Motrin, and does the pain go away completely? Have I gotten to the point now where really I get that nagging, aching pain all day long and it's starting to affect my sleep at night? At that point, that's not normal. You shouldn't live life like that. And I think there's a lot of good opportunities and options out there for patients, whether it's surgical or non-operative treatment. We have injections that we can do. They have different things called radiofrequency ablation for pain control. We've got exercise. They've proven that physical therapy, working on the muscles around the joints, whether it's the shoulder, the hip, the knee, these things can actually all help improve the pain for people, also increase their function. So once you get a pain that's hurting you bad enough, getting in, getting evaluated, getting a diagnosis doesn't mean you have to have surgery. Really what it does is it gives us the beginning of the information for you that we can now make a decision and see what we can do to help mitigate your symptoms. And again, sometimes that's surgery we offer fairly quickly. Most of the time we're gonna really try to exhaust non-operative treatment options before we discuss surgery. We may get people 2, 3, 5 years down the road before we start talking about surgery. And so when you've come to a point where your pain is so disabling because of a joint problem typically, that's usually when it's time that we start talking about surgery. And again, that's almost independent of x-rays. X-ray wise, you need to have a certain amount of joint space loss or arthritis before we would offer you surgery. But once you have a certain amount of arthritis, then we really look at your clinical picture. How bad is it bothering you? What is it really doing to affect your life? Are you sleeping through the night? Are you able to, engage still and walking? Are you able to get out and garden? Are you able to do these things that you normally used to like to do? And when you get to the point you're not enjoying the things that you used to enjoy, that's when we start talking surgery for people. Just because we have orthopedic surgeon after our name doesn't mean we're gonna sign you right up for surgery. A lot of times just finding out what you have going on can really bring peace of mind to you.